Hey everyone, I'm Kamal Parida and welcome to another empowering video by the Good Health Clinic. If you appreciate our content, please like and subscribe to our channel. Thank you and enjoy this video.
Let's look at some of these top-down numbers regarding cancer in India. 4.5 million cancer patients in India in 2019, leading to 1 million, 10 lakh cancer deaths in India. Almost a 200% growth in cancer patients in the last 30 years. You will often see when you read research reports on cancer in India, they'll say this growth in cancer is driven by population growth. Well, our population only grew by 60% in that same time period. So there's a large inconsistency between the growth in population and the growth in cancer in the same time period. So population alone does not explain the growth in cancer in India. On the other hand, there has been a nearly equal increase in the growth of metabolic disorders in India in the same time period. What are these metabolic disorders? Obesity, diabetes, hypertension, dyslipidemia, which is high cholesterol in our blood, right? So even at the face of it, just looking at these top-down numbers, we should be able to deduce that there is a clear linkage between our metabolic health and cancers, right? Which is why they have grown in lockstep in the last 30 years. This is a bottom-up view, and this comes from the National Cancer Institute in the US. On the left-hand side are the top 20 cancers. In orange are all of those cancers which are clearly correlated based on research over the last 20 years with obesity. If you are obese, you have that primary risk factor for these 15 cancers. And by the way, let me just also qualify the term obese here. Obese doesn't necessarily mean that you have to be 100 kilos, right, in body weight. If you have fat around your belly, right, and we'll go into this also subsequently in one of the pages, you might not look fat overall. But if you have central obesity, if you have fat around the belly, which I know a lot of men dismiss it as saying, oh, this is beer belly, right? You are at high risk if you have that central obesity. You'll see two more cancers in that list, which are prostate and esophageal, which are marked as yellow. Those are also linked to diet as a primary risk factor. So literally 15 of the top 20 cancers, which afflict 80% of cancer patients in India, have obesity or diet as a primary risk factor. Diabetes further compounds the risk of several cancers, right? So what you will see on the yellow chart on the left-hand side is the risk ratio goes up. It goes up to 2.5 times for liver cancer, which basically means your risk of getting liver cancer is 250% higher if you have diabetes. Now, let's sit back and think about the fact that there are 8 crore patients of diabetes in India. 60% of them are not even diagnosed yet. And 80% of those who are diagnosed, they do not achieve their doctor recommended health targets, which means they do not achieve their glucose levels. They do not achieve their weight and waist size, right? So in the next 10, 15 years, the problem of diabetes is exploding anyway. But what really alarms me is the fact that the cancers which are caused by diabetes and obesity are also going to explode. We need to take all of these steps now to be able to prevent the onslaught from these diseases. By the way, these diseases are not just a biological or a physiological burden. they are also a significant socio-economic burden, right? As I'm sure you're all aware, these diseases are incredibly costly to take care of in the long run. There are lakhs and lakhs of households in India which go under poverty line because they have to take debt to treat their family members of these diseases, because these diseases will show up as acute complications in the form of a heart attack or a stroke later, right? And so that's why, as the Good Health Clinic, as TGHC, our mission also has that social impact, which is how do we provide cost-effective health coaching programs for reversing these diseases for everyone. I think we can go quickly through this one. Like I was saying, the future doesn't look any better. It doesn't look any better because 90% of us, we are unable to make the diet and lifestyle changes for reversing these diseases, which is why there's going to be a 70% increase in diabetes prevalence by 2045, right? There's almost no emphasis on prevention of cancer. Diagnosis and treatment remains the only focus. Cancer prevention is only talked about in the context of tobacco, but not about metabolic health. And lastly, 50% of these patients have mental health issues. So we have to also think about that, which is if somebody has anxiety, if somebody has mild depression, if somebody is suffering from mood disorders, they're not thinking about going to the gym and working out and doing exercise, right? So we need to also help them solve their problem of this mental health issue before we get them to eat healthy and then exercise and be physically active. Result of all of this is that there's going to be a 12% increase in cancer prevalence in just the next 4 years.
Thank you for watching. For more details, please visit our website www.tghclinic.com. Please note that this video is for informational purposes only and does not constitute medical advice.